Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Hey, welcome to the program. Glad to have you with us. If it's your first time, we've been looking forward to meeting you. And if you're a returner, thank you very much. And by the way, if you have listened to the show before, you know that we bring you from vein and vascular surgery 101 all the way up to real serious stuff. And every now and again, we have an opportunity to break the mold and actually talk to a real patient of the doctor. We've had some really, really interesting folks in here. Today is no exception. And we hope that maybe once you start listening to this, maybe if it's not you, it's a loved one that might be having some of these concerns. And one thing I'm going to tell you right up front, with our special patient today, Doc, here's a guy that really actually took a pretty proactive look at what he wanted to do, because he'd gone to a lot of doctors for a lot of different things and not been either healed properly or not been given the answers that he was looking for.
Right. Yeah. As we hear time and time again, with these kind of problems, and it's good that the patient has to be or is persistent. Sometimes you have to be persistent, but yeah, one of the reasons why I like to bring patients here into the studio is for everybody to hear real live stories and real live problems, because many people out there have those kind of things.
And as you know, gang, we have a number. You got to go to veinclinicsofhawaii.com and check out what we do, some of the myriad of services that are provided on 4 islands. But I think really getting down to the nitty-gritty and finding out somebody, number one, that knows something's wrong, and number two, sets out on the road. Like if you take your car to the mechanic and it's going bumpity-bumpity, it won't go bumpity-bumpity when you're at the mechanic. You already know that. But if it goes bumpity-bumpity after you bring it back, what's your first reaction? Hey, they didn't fix my car. And it sounds like our special guest today, Warren, is a victim of that. Had some stuff that didn't get fixed, and he probably got like that guy on television. Remember that guy's, I'm mad as hell, and I'm not going to take this anymore.
Exactly.
Warren, thank you very much for joining us.
Thank you.
Let's talk about the circuitous route that you took to get to Dr. Juliff. Long before that, you are a top of your prime age.
Thank you.
Because we already know that most of us that suffer some sort of a venous problem, it took a long time to get there.
Yes, it's a path.
Yeah. Now, as a young guy, were you athletic and did you have any of the issues that you have today when you were younger?
No, that wasn't the case.
Yeah.
Vascular issues, though, varicose veins, is something that I've inherited.
Me too. Thanks, Mom. Yeah, thanks a lot, Mom.
You can't pick your parents, right? So my mother had it, and also my sister, but not to my degree.
What sort of reason do you think she suspected that? Did she work on her feet? Did she stand up?
Yes, she was on her feet a lot. Yeah,
okay.
Yes, and she was in the hospitality business, cooking and attending to a resort that we had, and so she was always on her feet like 10, 12 hours a day. Did
her ability wane? I mean, was she eventually not able to do certain things because of her condition?
As she got older, she found that she had to take a little more downtime, elevate her feet to bring down the swelling, and she had her veins stripped at one time.
Oh, boy.
How old do you think she was when she started having problems?
I would say that she would have been in her 60s.
Her 60s, okay. And at what point or what age was she when she had vein stripping? Even after that?
I would say that was in the early 60s.
Okay. Yeah. Mm-hmm. That's a little late, actually, but because so many women start to have problems more, 30s, middle age, especially after they have, 2 or 3 children. Yeah. But yeah, that genetic component almost always is there in one way or another. Many of our patients identify it in their immediate family members, parents. But,
you mentioned your sister, Warren.
Yes.
Younger sister, older sister?
Older sister, actually, yeah. And she was probably a lot earlier. She would be in her late 40s when she was experiencing it. And myself, I was probably in my late 40s when I started.
For any of you, was it cosmetic?
No.
Okay.
No.
Because we're seeing more and more of that now. Some of the things that you do, Doc, are strictly cosmetic, spider veins and things that in Hawaii we want our legs out in the open.
Sure.
But so at what time do you think that you had the first vein issues?
I would say in my 40s.
Wow.
Yeah, I would say in my 40s. I worked a lot in refrigeration in a produce department. I did many years, over 30-some years in the produce department. And you're working on cold, wet floors. You're on your feet all day. Concrete, yeah.
Hey, Doc, we need to take this guy shopping with us. I don't want that rat, lungworm, and all that stuff. He sounds like he'd be able to take a look at a head of lettuce and see what's in it.
Yeah.
Exactly.
Yeah, 36 years produce.
Yeah, that's great.
Yeah.
And do you like greens?
Greens?
Yeah.
Yes, I do.
Yeah. Okay. I was going to say, it'd be pretty hard to be a produce guy not doing the product. Okay, so at what time did it appear? First of all, Doc told me when we were waiting to get started here, and Doc, maybe you can reiterate it, and you and Warren can flush it out, that it was actually maybe a skin problem that was one of the first things. And we've talked about this before. At what time does a vein doctor give a dermatologist a patient, and vice versa?
Yeah, well, I think with Warren, his two major problems were swelling, and then swelling probably came first. Would you say that's correct?
Yes, and then the irritation on the skin.
Yeah, and then the skin, started to have major changes as time went on, and that's a very, very, very common scenario. It's also very common that people don't know why that's happening because it's not obvious. People with varicose veins or spider veins, they know they have a vein problem. It's easy to connect those two. But if all you have is a rash on your leg, that isn't necessarily intuitive. So how long were you having primarily just swelling before you started to see that rashy kind of stuff happen?
I would say the swelling was there for probably a good year. It was swelling, and then I started to develop a rash like the size of a quarter, and then eventually started consuming my whole lower legs.
Wow! Yeah. Full blown. Here comes one, right?
Yeah. And when Warren finally came into the office, it looked bad. Yeah. There's no question about that.
But interestingly enough, actually, coming on that, sometimes they come on real quick.
Yes.
Like I had one that was like overnight. But what you're talking about is you sort of saw this thing coming, but did you go to a specialist, a dermatologist or GP? How many people took a look at this and tried to help you?
More than I got.
Is that right? Wow.
And they were varying in their approach. Some of them would say that it was an infection, and then they want to give me antibiotics.
Of course.
Some
been there.
Some said it was eczema. Then they wanted to put me on cortisone, and then they wanted to try all these different things. But I knew in my heart that that's not what was causing it.
Wow.
That was just a symptom of an underlying problem, and because I had varicose veins before. And I did a lot of my due diligence and reading I knew this was something.
So you connected it.
Yeah. And even I went to vascular surgeons, and they wanted to prescribe me cortisones and steroids and all sorts of things.
Doc, that sounds to me like they didn't come to the veins clinics of Hawaii, number one. But number two is that there would be, I guess, a protocol. That, you take a look at something and 90% it's this, so that's the medicine you give it.
Yeah.
But how long did you wait before you said, yay, I really like you guys, but this is not working?
I got to the point that I was running into walls with all these doctors, and they said, well, come back and such as that. What? And I got to the point I says, well, if I think I need your services, I'll call you.
Yeah, don't call me.
Yeah. I was, because I was already frustrated. And then I actually saw their ad in one of the local papers.
Right.
And at that time, I think it was called Bailey's Vein Clinic.
You had the planets all lined up so you could get some treatment. Is that, in other words?
Yeah, it was when I called the receptionist, I explained what I was going through, and so we got an appointment, and it reassured what I was feeling already.
Had you you said that you had varicose veins in the past, and you did some reading and educational sort of things. Did you ever run across the idea that rashy kind of skin change that you were experiencing could be part of a vein problem, just in general?
No, most of the research I did showed swelling, heavy legs, achy, things like that, but not so much the dermatology of the skin, like the rashes and that.
What about discoloration?
I had that. I had that. I knew that was a circulation issue. And so I started connecting the dots and realized that I've got something wrong, vascular, that's causing this. Yeah.
The main reason I wanted Warren to come in and talk today is because his exact presentation, and we see over and over again, it commonly gets misdiagnosed and mishandled. And so, there are plenty of, unfortunately, physicians that aren't in tune with what we do. And I'm not being critical, because a lot of what we do is pretty new.
Sure.
And most of what we do was not taught in medical school. I know when I went through. So it's just a job for us to educate. But in the meantime, it's good for patients out there to realize that this kind of thing, which is not immediately connected with vein disease, very well may be due to that. And sometimes you have to look in other places.
One of the places you got to look as part of your responsibility as a listener is to go to veinclinicsofhawaii.com and click on some of these things and, see what we're talking about. But we sort of skipped over something earlier with Warren. Dr. Julep is the medical director at Vein Clinics of Hawaii, all 4 campuses, Big Island, on Kauai, Maui, and here on Oahu. Got a lot of great people working for them and a bunch of great patients like Warren. We skipped over something earlier because it sounded to me like you developed what I had, and that was a ulcer or a puka that wouldn't heal.
Mine never actually got to the point of being ulcerated.
Okay, good. Lucky you. Yeah.
But I was hinging on something like that happening if I didn't receive treatment.
That's pretty good. If you can nip it in the bud, did you?
Well, yeah, but we didn't really nip it in the bud. I mean, we were a little late getting to the party, but I mean, I remember what Warren's legs looked like when he first came in, and although many people with venous disease, lower leg ulcer is one of those other things that people don't necessarily connect with venous disease. Often it is a result of venous insufficiency. But in equating an ulcer to what Warren had, it is very, very similar. I mean, they're both at the same stage in venous disease, and the way that his skin looked, it was almost like a huge ulcer on the skin. I mean, it was that raw, that painful. I mean, it had to have been very, very uncomfortable.
I'm curious about that because we've talked about that before. Some people describe pain like I do, itching. Some say it numb. Some say it was throbbing. Some say it's stretching, or it's sort of the touch. What were some of the indicators of the symptoms that you had?
Well, you just touched on 3 of them.
Oh, yeah. Oh, boy. You're a train wreck. Yeah.
Stretching and pulling, like the skin is going to pull apart. Itchy, most definitely. And sharp shooting pains in the lower below the knee area.
I know that a lot of times we try to differentiate between venous conditions and diabetic conditions. Was this all above your ankle, mostly?
Actually, a little bit below my ankle toward the foot, also, but nothing higher than the shin.
Yeah, isn't that's that gator area that you call it, right? Yeah. Right in the middle there.
It's just a typical. It's after doing a lot of research, it was textbook.
Mm-hmm.
Yeah.
Yeah, thank goodness they have the textbooks, but unfortunately, sometimes we're 20 years too late in reading the things or being exposed to it, right?
Yeah. That's a very, very typical area for problems with vein disease, not only rashing and all that sort of stuff, but ulcers and discoloration, et cetera, as you said, the gator area.
Well, you have mentioned this, and maybe Warren can expound on it a little bit, but sometimes this itchiness will cause you even inadvertently to scratch the skin until it breaks.
Yeah.
And now you got,
definitely,
another problem, right?
Right, yeah, it snowballs.
Yeah.
It turns into, from a rash into an active ulcer.
Yeah.
But, you Warren, before you mentioned eczema, and, somebody had said, well, gee, maybe this is just a form of eczema. And actually, that's correct, because there is something out there that we call venous eczema. Mm-hmm. And that's because, we see that rashy sort of change in the skin in people with long-standing venous insufficiency. Unfortunately, it's not treated with, creams and steroids and salves and all that sort of stuff. As a matter of fact, we try not to put steroids on that type of issue.
You're talking about cortisone and ointments and cream and all that
stuff. Right. Because steroids in general, in and of themselves, can have a deleterious effect on the skin. Number one. Number two, it's not addressing the underlying problem in any way, shape, or form.
Before you got into Dr. Julef's House of Pain in the legs, I'm kidding. At what point in time did you ever try compression of any kind, elevation, and maybe even compression garments like I'm wearing right now?
Yeah, I was doing all those things.
Wow.
And had done that for years.
Mm-hmm.
But maybe the compression wasn't strong enough. It was only a 15. So now I'm wearing like a 20-30 compression, which seems to be very helpful. But I was trying to do all those things, and even putting running cold water, trying to.
Yeah, isn't it interesting how people will be very proactive? He doesn't sound like he was waiting for somebody to to do it. He's doing this stuff.
No. Well, yeah, Warren was very proactive. Even before he got to us, but even after he got to us, he was very, very involved with his treatment. But yeah, he was doing, the legwork as far as looking into things, looking into options, trying them out to see if they worked or not, and just kind of plugging along until he kind of, got to the right place, I guess.
Okay, now, and we're going to get to that in a moment. And the right place, of course, is veinclinicsofhawaii.com. But obviously, this is something that you were sort of working on for sort of a long time. What was the aha moment? I mean, even before you came to Dr. Julef, did you say, I kind of really know what this is. Now I need to find somebody to help me?
Yes, I had the feeling I knew what was happening, but I couldn't get anybody to concur with me.
It's hard when you're right and everybody else is wrong, isn't it?
I've felt like that before.
Yeah, not like I'm the doctor.
Yeah.
But I knew the other doctors were just blowing smoke at me, and I knew that that's not the answer. And one thing I wanted to mention too, Dr. Julef mentioned with regards to an air compression massage machine, and I think I've done well using that. Every night, half an hour, I use a sequential massager, and it's like a air compression bags, and it massages from the foot up to the thigh, and I do that every night faithfully for half an hour.
Yeah, see, that's the part, isn't it, Doc? When you say, I say I wear my socks every day. Well, I kind of do, but on the weekends I don't, because I'm efficient and I'm out. But I think that maybe, that. So who suggested that? Did you research that? Was that something Dr. Julef's guys, did he suggest it on that garment?
Yes.
Yeah.
And
so they showed you how to use it, and then what happened?
Well, I researched, I guess through the medical community, it's pretty expensive. So I went on Amazon and found one that had a very good rating with people who had similar problems.
Wow, that's pretty good.
Yeah, that was good. Yeah, actually, Warren was the first one that told me about this type of device being on Amazon. So we have used it since then. But yeah, even going back though, even before you got to us, you were using compression. At that point, were you having a problem with a rash already when you started using compression, or was it just swelling?
I was starting to get just a very bit of discoloration. You know how people get that in the around the foot area, the top of the foot. I was getting that, and then I did have, like I said, something around the size of a quarter starting, a little darkening, and it was kind of itchy. And then
that looked like it was the lid of an ulcer, doesn't it?
Yeah,
it's on that way.
Sure,
yeah.
Could have been. Yeah, definitely. Yeah. So it just kind of slowly got worse with time. So when that first appeared, what do you think the period of time was between that first appearing and you coming into the office when you had like a full blown rash that was affecting your quality of life? Quite frankly,
it was just a matter of months.
Just months.
But even that's a long time. When you're suffering. But we have seen, and I'm a patient. We have seen. I'm sure you've heard about this. Sometimes people have this huge ulcer in their leg for like a year or longer, and trying everything over and over again and expecting a different result. Well, we know what that's the definition of, right?
That's right.
So when you got into that and finally started receiving the treatment, at what point in time did you start feeling this is the path where I've got, this is what we're supposed to do?
Well, it went it went bad, like a very with after the treatment there was like an agitation in your body with you've had all this work done and it's inflamed and then we're doing the Una boots to help with the healing of the skin, and then I actually purchased those myself on Amazon and learned how to wrap my own legs.
Hey, this guy's got a direct connection to Amazon.com, right?
Yeah.
Good.
Amazon Prime,
that's the way of the world, Yeah, same with us.
Amazon Medical Prime.
Yeah.
So, and I went on a lot of websites where people would have blogs, what helped them, what didn't help them. And I also actually found a site in the UK that does a lot of the same thing as Dr. Juleff does. And so I was able to really appreciate that what he was doing was right in line with this place in the UK.
Yeah, I think all of that kind of goes to the fact that, unfortunately, often it's not, well, most of the time it's a little more complicated than most people think. I think a lot of people come into the office and they think they're going to get, 2 or 3 little injections and everything's going to be fine. Now,
that's the instant gratification society that we're in, right?
That's a big part of it. I'm sure Warren didn't feel that way. I mean, I'm sure he had a very, a much more realistic view of what was going to happen. But when he first came in, we did the usual sorts of things. We did an ultrasound to figure out what was going on. We found out that he did have this thing that we call venous insufficiency. A number of the veins in his legs were not functioning properly, and basically it's the blood's going in the wrong direction. And we initially treated that. We treated that with something that we call endovenous ablation, and that is to use a special catheter to actually close down the veins that are not functioning properly. And that sort of forces the body then to reroute blood and get it going in the right direction, because the underlying, basic problem is that blood's going in the wrong direction. It's creating swelling. It's creating an increase in the pressure within the entire venous system. And that is then what is getting transmitted out to the skin, and having, a number of different, adverse, kind of reactions and effects that then will result in, the rashy kind of thing, severe rash that Warren had, or ulceration, or any of the other, multiple different things that can happen.
The audience is always interested every time we're able to, corral a patient into the studio. And by the way, gang, Warren is a patient of Dr. Juleff at the Honolulu branch of the Vein Clinics of Hawaii. But we're island-wide, and you go to veinclinicsofhawaii.com and find out, if you're on a neighbor island, how you can get some help in the meantime. If you want a phone number, I know some of you are archaic and you still use phones. If you have a phone number that you want, I suggest you call the Honolulu office, and you'll get assigned, if you're on the neighbor islands, to the right office. That number is 427-5565, and I'll give it to you again a little later on. 427-5565. Okay. Doc was talking about this instant gratification society that he agreed with. I love that phrase. And almost all of us want it fixed right away. Were you ever embarrassed about the way you looked? Did you wear long pants or socks, or did you do that stuff? Because I did.
Oh, yes,
definitely. I tried to tell myself I'm just sunburned, and a year after having the sunburn without being in the sun, I think, well, it can't be sunburn. It must be something else. So I'm wondering how much of this was partially due to maybe lack of being able to do the things you want to do, but maybe the way you looked.
I live in compression socks.
Yeah.
I literally do. I take them off at night, obviously, but and I also use a wedge pillow.
Mm-hmm. Yeah, that's a great one. And my wife calls mine the mountain. No. Go build the mountain. Yeah.
So I use that, and I after I use the machine, the compression machine, then when I go to bed, I elevate my leg, and usually by morning it's like they're like the way they're supposed to be. There's no swelling whatsoever.
Do you sometimes look forward to whatever you're doing at night, getting home to do that, or in the afternoon, whenever you do it?
Yes, because I schedule a half hour every evening after dinner, and it's just a time to maybe read or catch up on emails and things like that.
That's pretty good, Doc, don't you think? Getting a routine going.
Oh, yeah, definitely. And that brings up another topic, and that is that unfortunately, in problems like this, they're multifactorial, and there's different things going on, and a variety of unfortunately bad things that are kind of pushing the leg in the wrong direction. But you really have to get into the habit of doing the things you have to do, and Warren has been excellent at that, because it's an ongoing thing. Unfortunately, it's probably something that patients like yourself will always have to deal with in one way or another, and sometimes it's just a matter of trying to find out the combination of things that are going to maintain the most control that you can possibly have. Getting back to your initial treatment, it's interesting. You said that we did those initial procedures, and you had kind of a flare up. Things got worse for a little while. And that's often the case. Yeah. We see that periodically, whether it's with skin changes, swelling, or whatever, because the procedures that we do create so much inflammation inside the leg that it takes a while for that inflammation to settle down, and then for tissue to start actually going through a real healing process. But then in the meantime, there were several different things that we had to resort to, and Warren mentioned one of them, Una boots, and we've talked about Una boots before. He became an expert at that.
Yeah. What I'm guessing at is that everybody's learned. I've learned, and some of the other patients we've talked to, and it even sounds like you have, that it's baby steps. But what it is, it's returning to be more in charge instead of being a victim to something. Oh God, I got to go lay down and put my legs up. You go put your legs up when you want to.
That's right. And I try to stay very active.
Good for you.
I walk every day. I try to go swim, and it stings sometimes with the skin when it was and then I like golf, so I still try to golf as often as I can.
You got a cart or not? You with the cart?
I do.
Me too.
I do. Yeah. But a lot of the courses here in Hawaii, that you have to use a cart. But you still get a lot of walking. Sure. Even if you are using a cart. So I like that. But anything that's worthwhile, you got to just learn patience. Mm-hmm. You got to learn patience. Yeah, it's something that a patient is, not necessarily how he acts. That's why they call it a patient.
Yeah, exactly. but it seems to me like you have reversed, Doc. Maybe you can explain how you did it in the practice, where you not only were able to identify the core issues that Warren had, but get working on them to a point where there's measurable progress that's going to keep somebody coming back instead of saying, okay, I'll see you in 6 months.
Yeah.
You know?
And that's the key, not only in this kind of situation, but I think in taking care of vein disease in general, which is something that we didn't do before. You know, back when our mothers and grandmothers had vein stripping, you know, they didn't have adequate follow-up in any way, shape, or form. And consequently, you know, many of those people, most of those people come back with recurrent problems. So I think all vein patients need to have, you know, routine follow-up, but especially when you're dealing with a problem like Warren has with skin problems, discoloration, ulceration, etc. You really need to stay on top of that and come back for periodic surveillance. And sometimes we have to do some further things. I mean, and Warren has seen that already.
That's why I was interested. Some of you have listened and learned that there are 6 stages to venous disease. There's 6 different places where you are. And the quicker you get diagnosed is the quicker you find out where on that scale you belong. Mm-hmm. So were you getting up that scale pretty well?
I think so. Yeah, I was. I looked pretty bad.
Yeah.
Like I definitely. Well, my legs were oozing.
Mm-hmm.
So, yes.
Okay. Hey, listen. I told you it was going to get ugly here, gang. Now it's going to get ugly. So, Doc, what is that? What are you talking about? Is it just fluid coming out of your legs?
It's like a pinkish brownish fluid.
It's because of the increased hydrostatic pressure within the venous system. Fluid is actually moving out of the vascular, what we call the vascular space, just within blood vessels and going out into the soft tissue. And then when you connect that with abnormal skin, the skin is no longer has the integrity that it normally would.
And by the way, we got to explain to people that the skin does 2 things. Yeah. It prevents stuff from coming in, and it also prevents stuff from going out.
Exactly.
So it's a busy little thing, the skin thing.
Yeah. So we see that periodically, but it's an indication of a very advanced stage of the problem. Getting back to the clinical classifications, the highest one is C6.
C6, yeah.
And that's when you have an ulcer. Well, Warren was just on the other side of that. I mean, he was... there's 4. 1, 2, 3, 4. He was 4B, and 5 is somebody who has had an ulcer but it healed. C6 is ulceration, but at any time, Warren could have developed an ulcer. I mean, there's no question about that.
Well, I think maybe, and patients got to get this, and I think that if you've been a regular listener to the show, and if you go to veinclinicsofhawaii.com and look at some of the different categories, some are fun. But by the way, we got a whole show coming up about some of the fun things going on at vein clinics. But I think that maybe identifying where you are, it gave me peace because now I know where I am. So it must be because you seem, Warren, like you really took control of that. And I'm guessing you're probably looking, when's it going to get better, instead of, I've learned now that it's not going to get worse. If we treat this, it's probably not going to get worse if we stay on top of it.
That's right. That's the goal. You don't want to revert back to the way you were. Mm-hmm. And it can happen very easily. I see people walking on the street, and I go, "Oh my goodness!"
Yeah, I'm the same way. Doc and I talk about this all the time. You going into the big store and watching somebody using the cart as a crutch, and you say, number 1, he's got a bad hip. I had both mine done, and number 2, he's got some terrible looking legs. This guy needs some of my socks.
Yeah, and then they're wearing rubber slippers. Yeah.
Oh yeah, absolutely.
Yeah.
But I guess, Doc, the salvation is, and it maybe is that when somebody comes in. At this point in time, you've handled so many patients that there's nobody that's not going to get good attention diagnosed. And let's talk about that. When Warren finally arrived at your gates, when did you become aware of this guy as a patient, and what was your initial thoughts, and how's it working out for you?
Well, I think Warren, when he showed up, it was his scenario again was something that we recognized because we have seen that before. So we went. And swelling was a problem. I mean, it was a big part of the situation. Obviously, with swelling, with skin changes too. Our job is to make sure that it's not due to their venous system. That there isn't a vein origin. Much of the time it is.
Unfortunately, and you've learned over the time listening to the program, there's a lot of stuff going on in your legs. not just the veins, but the arteries, the lymph, and the water, and the bones, and the cartilage, and all that kind of stuff. It's a lot of stuff. And let's not completely run away from the oozing deal, because I want to know when it started. Did it stop? And what does that get attributed to? Do you think it could come back?
I think if I didn't give proper attention and do my due diligence, it could get back. And Dr. Juleff was really good with me. He let me do some of my own things. Like I don't take anti-inflammatories, or I don't take those things. I do a lot of alternative medicine myself, and I think he realized that the proof was in the pudding. It worked for me, and I'm not promoting it, but just for me, I didn't do well on the pharmaceutical.
That's really interesting you say that, because I know we're all victims, especially when you're watching television at night. 30 seconds tells you about this great medicine, and then 90 seconds gives you all the side effects. Were you turned off by some of that stuff? Hey, I'd rather have the ulcer than have suicidal thoughts and dreams, all that stuff. Yeah. Definitely. Yeah, it's like I said, I don't try to promote it for anybody, but I did many hours of research, and I found some alternative natural remedies that seem to help me quite well, and that's part of my regimen with everything else. It's interesting, Doc, because we have bridged this before. Things like what role does nutrition play? And you've often said that it's not really documented if nutrition has a whole bunch to do with your circulation. Certainly it has to do with your well-being, but it may or may not have anything to do with that. So how do you get somebody that wants to do a holistic approach and do some of the things that Warren wanted to do, and still yet you knew that you had to have him do part of the road your way because that was necessary?
Well, and that's the key. And I'm not closed at all about alternative types of things. Because for different people that might work better. I mean, I'm perfectly fine with that. But yeah, there has to be a give and take, and I think that Warren and I have developed that kind of relationship. I mean, there's got to be something that we're bringing to the table as well to help him. I think we did.
That's why I'm thinking there's a bunch of Warrens out there, Warren, and I think taking the first step from maybe not necessarily the vanity part, but you said your mom, my mom, Doc's explained this before. I remember my mother was she was a self-starting businesswoman that had her own stores on her feet 18 hours a day. And that was literally, she'd go in the hospital for days and sometimes weeks at a time. So that would turn me off. I'm not doing what my mom did, but now of course it's the opposite. Bring it on. Do you have the same attitude about some, like Doc said earlier, a lot of what we're doing at the Vein Clinics of Wise new?
Yeah, you have to be open-minded to a certain degree, and I think too nutrition is good. If you don't look after your body, if you live on junk food, don't expect wonders.
Garbage in, garbage out.
Yes.
Right? I mean, but that's significant, though, Doc, because we've talked about this before, and a lot of the patients that you have are sometimes morbidly obese, sometimes just have really, really bad other conditions, comorbidities, if you will, and trying to differentiate between all the things going wrong with me or a Warren must be quite up to the challenge. You got to differentiate this stuff. It
is, because we have patients coming in with complaints about their legs, and often it's due to a variety of different things. Because, like you pointed out before, there's a whole bunch of stuff going on down there, and not only the veins but the arteries, the lymphatic system. You mentioned lymph before, and that's a huge consideration when we're approaching people with swelling, because lymphedema, when it's due to a swelling, edema that's due to the lymphatic system, something we call lymphedema, is often a part of the picture with people who have venous insufficiency. Often. So we have to manage that. And the way that we manage that, one of the big ways that we manage that is not only with compression-type wraps, which I think we're being addressed with the Uniboot, but also the sequential compression device. That's a device. Warren mentioned it before. It's worth talking about a little bit because it's a device that really, really can be very, very helpful. But it takes a certain amount of work on the behalf of the patient.
Sounds like you're making some sort of commitment here.
Yeah, exactly. Yeah. You have to. The sequential compression device is a huge, kind of a tube. It's almost like a blood pressure cuff that goes over your entire leg, and you attach it through a bunch of tubes to an air compressor, basically, and you switch it on, and then it inflates, and it inflates down by your feet first, and then it continues to inflate all the way up the leg, and the theory is that it's pushing fluid upward, which it does.
Which it does. Incidentally, Warren, I think this is pretty cool. You have a place for this. And you know that your support system is Dr. Juleff and Vein Clinics of Hawaii. But talk about your domestic system. By the way, as we're recording the show for use on the air with the Vein Clinics of Hawaii, and Warren so kindly giving us this time to spend, his wife is sitting out in our lobby waiting for him to start having fun so she can go start having fun. Let's talk about that a little bit because, I do know that a lot of times people's treatment is slowed down because they just don't have support.
Yeah, no, my wife is very good like that. Very supportive. Actually, sometimes she'll remind, "Did you do your legs yet?"
Good,
yeah,
good girl. Yeah.
So it's good. And matter of fact, my wife and my daughter use the machine too sometimes. My daughter loves to do hiking, and so sometimes after she's finished a large hike and stuff like that, she'll ask, "Dad, can I use your machine?"
Yeah, that's really
because it's better than her trying to get somebody to massage her.
Well, I can tell you one thing. So many people have heard us talking about compression stockings.
Yeah.
That we have people that are going out in front of a problem, just figuring, I travel, I'm gonna get some compression stockings. Yeah. And Dr. Juleff, you said this is important. You see some of these, and we really shouldn't call them socks. They're actually garments. They're actually medical garments. And isn't it interesting how the sporting world has grasped a hold of these things? They're making them in colors and fashions, and it's because these athletes decide that their downtime is shorter and their strength is more.
Well, not only the athletes deciding that, but there is some scientific evidence behind the fact that with compression, especially of the lower leg, there's a quicker muscle recovery and all this sort of stuff. So, compression stockings are good not only for people with vein problems or lymphedema, but also for general health primarily in exercise and activities like that.
Yeah, that's pretty encouraging. Now, based on that, Warren, a good part of your waking hours, you're concentrating on that. But what's it allowed you to do to have fun? You mentioned before you like golf. Mm-hmm. Were you at one point in time not able to do the things you wanted to do at work because of discomfort?
Yeah, I was hampered, especially when we talk about the gory stuff. My legs were oozing. Mm-hmm. I also do interior painting, and I've done that for many years also. So I would have to halftime change my socks.
Yeah.
Because and so I got away from wearing white socks because it was just
the painter's white stuff not so good on that. No.
But the one thing I wanted to mention with regards to the machine, I take that everywhere with me when I travel. If I go on the plane, I definitely wear my socks. But I take that machine with me, and everywhere I go, even if I go inter-island for a day or two, I take the machine with me, and I faithfully use that machine.
This is a great accessory, Doc. I know that just having Warren here to be able to say these things, I mean, I know that, your dentist knows if you've been cleaning your teeth or not. And I think your venous surgeon knows if you've been wearing your socks, if you've been taking care of yourself, because, and I want to make sure that people understand, taking that first, I don't want to say it's a leap of faith, but obviously here, Warren was a pretty challenging case. I mean, a lot of things going wrong, and yet he was still able to function. But how about being able to function better?
Sure, yeah. And that's what it's all about. I mean, quality of life is a huge part of what we're trying to achieve, But was there ever a time when your leg problems actually interfered with your ability to, let's say, go to work.
Well, to work the way that I want to work, yes, most definitely. I'm old school, so when I work, I work like 8-10 hours a day. But when it was at its peak, I'd work for just a few hours, and then I'd go ice. I have to go ice my legs because they were just hurting so bad.
Okay, so remember we talked earlier about how pain manifests itself. People look at some things itchy, scratchy, numb. It's still the same thing.
Yes,
but it was pain.
Yes, it was pain. It was shooting pain. It was that pulling pain, stretching. It was all those things.
Doc, it's pretty interesting to me that when somebody is so motivated to say, I'm not going to do this anymore. In other words, let's find out that there are people out there. You might be like Warren or me. And of course, you might have somebody in your family that you see is not able to enjoy themselves. It's not really just being able to enjoy themselves. It's able to work, to deal with family.
Absolutely. Absolutely. Yeah, I mean, because, it affects everything, including family life. Yeah. When you can't, when dad can't come along or mom is laid up or whatever, it's not only affecting that person, but everybody around that person.
Maybe we should ask this. Obviously, the ones that are around you that are closest to you, they've seen the improvement. They've seen your attitude. But what about people that you don't see for a while? Say, have you lost weight? Are you taller? Are you have you been getting out? You look different. Do you?
Yeah, people mention that. Yeah. I was very private, actually, as to how bad my legs were.
Sure.
Basically, only my own family knew. I remember when it was at its peak, I didn't want infection to be in, and I used to pour peroxide, and it looked like snow.
Yeah, but here's something interesting. Yeah. I really respect and appreciate that, and I think that our audience would, to fess up to that is a pretty tough deal. Yeah. And I'm thinking that a lot of times with men, it's not cosmetic as much. What do I care what the things look like? Yeah. I just don't want to hurt or ooze.
Yes. Yeah. It's having confidence in doing things. Yeah. When you're battling, this like 24/7, it does hamper your lifestyle. It also hampers your your positivity for many activities in your life. But I think too, I really tried to have a good mental attitude toward this, and try to be positive that it's going to get better. It's maybe not as fast as I like.
Did you hear from wife or others, hey, you better go get that looked at? That's not doing so good, man. Don't put up with that anymore. Go get that fixed.
Yeah, it was. But mostly the doctors other doctors I saw, they thought it was a quick fix. Oh, we'll just put you on some steroids. We'll just lather the cortisone on there, and it'll calm it down. Yes, it maybe calm it down a little bit, but as soon as you stop, it comes back with a vengeance.
You were doing Una boots for yourself for quite a while, as I remember.
Yeah. By the case.
We remind everybody what the Una boot is. What does it do?
Yeah, the Una boot is not a boot at all. It's a medicated wrap, and comes in a little package. It's basically gauze, a very thin gauze that's impregnated with either the silver or there's a variety of different things, or zinc, and you wrap that on your leg, and then it's a 3-layer wrap. You wrap the medicated gauze, and then another thicker gauze, and then usually either an ACE wrap, or we typically use something called Coban. And that's what we call an Una boot. Now, that's something that has to be changed, ideally, a couple times a week, and I think that was part of Warren's problem.
Yeah, that's
was
kind
just
of the big humbug.
Getting to the office twice
yeah.
a week, and so he took it upon himself to learn how to do it, and that's great, you know. But the Una boot does two things. It's not only beneficial because of the medication that's impregnated into the gauze, but probably more importantly, it's a wrap that is very efficient at controlling and diminishing swelling. Because you probably that was one of the things that controlled your swelling the most, was being able to do those Unu boots, weekly.
Yeah, actually, if you do the Unu boot properly and with also the elastic wrap, you actually don't even have to wear a compression sock. Mm-hmm. And I did find some that were zinc, but also had chamomile in.
Oh, yeah, like the tea,
yeah,
like the flower.
which really cut down on the itching.
Yeah.
These symptoms, in many respects, that pain or itching or swelling or burning or freezing is a good thing, because otherwise, how would you know there's something going wrong?
Yeah, sure. So, Warren, what were some of the other things that you did from a more, naturopathic sort of direction?
Yeah. Well, I knew that my body was inflamed. Mm-hmm. I just need to look at my legs and I could tell it's inflamed. So I started doing a few things like turmeric and some other herbs and like frankincense and some other things. And I also ate foods that were high in like omega-3s. Yeah. Because those are also like a natural anti-inflammatory. And I did also the aloe. I take the or aloe leaf, and I would sometimes even just harvest the plant itself.
Oh, sure.
And I would just rub that on my leg at night and let that. And then the other thing I would use is a water. It's a colloidal silver, and that helps to heal. Like the old days when they said the person was born with a silver spoon.
Yeah, really.
Yeah. Well, the silver is good for fighting infection.
Well, that certainly was used on my leg. My venous ulcer was treated with silver stuff.
Yeah.
Isn't this actually the patient from heaven instead of from the other place? When you think about it, because here's a guy who suffered and tried stuff. Yeah. Some work, some don't. You just got to keep on plugging.
Well, the whole story is a testament to Warren's, I think work ethic and determination. Just staying positive is a huge chore in and of itself. Going through all of that. Warren is a great patient. There's no question about that. Much more easily dealt with, especially when we're trying to deal with fairly complicated problems, than a patient who won't, do what you ask them to do. And you mentioned before about stockings. Yes, we know when a patient comes in and says, and we ask them, "Have you been wearing your stockings?" And they say, yes, every day. We know who's
not
telling
today.
the
I forgot today, but not yet.
Yeah, right. Just took them off, in the car.
Yeah.
I think you saw some of the greatest improvement when I stared using the machine.
Mm-hmm. Yeah, I think that was a key. That was a key.
That was the best $300 I ever spent.
Does it feel good when you're using it?
Yeah. And my leg is all like red after it's finished after POW, but that's because it's been massaging and
get all that circulation going.
I can put that machine on, and my calves and my ankles can have swelling, but when I'm finished, it's greatly diminished because it's been moving all that circulation, that blood around.
Yeah, so you got to do a little bit more than just elevate the legs for a few minutes.
Right.
Yeah, you got to do it. But I think that what's really been a benefit for all you out there listeners is that here's a guy that had a multiplicity of problems, and one by one, it's like, I think that probably, Warren, everything that you got addressed was you were able to add one more thing to the bucket list. I mean, if you can't do the things you want to do, and you can take these steps, you're in better shape. Yeah, I think that's a great way to finish things off today, Warren. And what's next? I mean, how often do you see the doc, and what are you working on right this minute?
I've had great improvement on my right leg. It's almost, except for the bit of discoloration, it's I'd be happy just if it was just like that. The left leg has been a little more, problematic. Have had a blood clot in that leg. So it's healing a little slower. Its circulation is a little more impeded than the right leg, but I'm confident that we're going to get it.
And that's a great way to end up. Thank you so much for being with us, Warren, and everybody listening. We'll see you again next time. In the meantime, you go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. Or if you want to use that telephone I was telling you about, now you can write it down, 427-5565. 427-5565. See you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.